Hello everyone, now let us discuss about 2023 ICD 10CM coding guidelines for Chapter 21 Part 8. As we have discussed earlier, Chapter 21 mainly deals with the Z codes, that are factors influencing health status and contact with health services. In the current session, we will be completing the entire status codes, the Z codes that are pertinent to status. In this session, we will be discussing about Z92, which is nothing but personal history of medical treatment, and Z93, which deals with artificial opening status, Z94, which deals with transplanted organ and tissue status, Z95, which deals with presence of cardiac and vascular implants and grafts, Z96, which deals with presence of other functional implants, Z97, which deals with presence of other devices, Z98, which deals with other post-procedural states. Assign the code Z98.85, that is transplanted organ removal status, to indicate that a transplanted organ has been previously removed, and this code should not be assigned for the encounter in which transplanted organ is removed. When it is currently being removed, in that encounter you should not code that. You should code Z98.85 when a transplanted organ has been previously removed, and the complication necessitating the removal of the transplanted organ should be assigned for the encounter which is mainly governing the transplanted organ removal. The next is Z99, dependence on enabling machines and devices not elsewhere classified. One important note is categories 89 to 90 and 93 to 99 are for use only if there is no complication or malfunction of the organ or tissue replaced, the amputation site and the equipment which the patient is dependent. These status codes should only be used if there is no complication. Whenever there is complication due to any of these, then the complication code must be coded, not the status code. Now first coming to Z92 series, which is nothing but personal history of medicinal treatment. The first code is Z92.0, personal history of contraception. The next is Z92.21, personal history of anti-neoplastic chemotherapy. The next is Z92.22, personal history of monoclonal drug therapy. Z92.23 indicates personal history of estrogen therapy, and Z92.240 indicates personal history of inhaled steroid therapy. The next is Z92.241. This indicates personal history of systemic steroid therapy or personal history of steroid therapy NOS. Next is Z92.25. It indicates personal history of immunosuppression therapy. The next code is Z92.29. It indicates personal history of other drug therapy. The next is Z92.3. Personal history of irradiation or personal history of exposure to therapeutic radiation. The next is Z92.81. It deals with personal history of extracorporeal membrane oxygenation, ECMO. The next is Z92.82. Status post administration of TPA, that is tissue plasminogen activator, in a different facility within the last 24 hours prior to the admission to current facility. The next is Z92.83, personal history of failed moderate sedation or personal history of failed conscious sedation. The next is Z92.84, personal history of unintended awareness under general anesthesia. The next is Z92.850, personal history of chimeric antigen receptor T cell therapy or personal history of CAR T cell therapy. The next is Z92.858, personal history of other cellular therapy. Next is Z92.859, personal history of cellular therapy unspecified. The next is Z92.86, personal history of gene therapy. The next is Z92.89, personal history of other medical treatment. Now coming to next category, Z93, artificial opening status. The first code is Z93.0. It indicates tracheostomy status. The next is Z93.1. It indicates gastrotomy status. Ostomy means opening, surgical opening. So tracheostomy is surgical opening of trachea. That status must be indicated. So Z93.0 indicates tracheostomy status. Z93.1 indicates gastrotomy status. Z93.2 indicates ileostomy status. And Z93.3 indicates colostomy status. Z93.4 indicates other artificial opening of gastrointestinal tract status. Next is Z93.50. It indicates unspecified cystotomy status. The next is Z93.51. It indicates cutaneous vesiculostomy status. The next is Z93.52. It indicates appendico-vesicostomy status. The next is Z93.59. It indicates other cystotomy status. Next is Z93.6. Indicates other artificial opening of urinary tract status or nephrostomy status or ureterostomy status or ureterostomy status. Ureterostomy or ureterostomy or nephrostomy. In any of the case, you need to code Z93.6. The next is Z93.8, other artificial opening status. And finally Z93.9, it indicates artificial opening status unspecified. The next is Z94 series, that is nothing but transplanted organ and tissue status. The first code is Z94.0. It indicates kidney transplant status. The next is Z94.1. It indicates heart transplant status. Z94.2 is for lung transplant status. Z94.3 is for heart and lung transplant status. And Z94.4 is for liver transplant status. Z94.5 is for skin transplant status or autogenous skin transplant status. And Z94.6 is for bone transplant status. Z94.7 is for corneal transplant status. Z94.81 is for bone marrow transplant status. Z94.82 is for intestine transplant status. Z94.83 is for pancreas transplant status. And Z94.84 is for stem cell transplant status. Z94.89 is for other transplanted organ and tissue status. Finally, Z94.9 is indicated for transplanted organ and tissue status unspecified. Now let us see an example. Patient with residual chronic kidney disease stage 1 after kidney transplant. So the first code would be N18.1 CKD stage 1 followed by Z94.0 that indicates kidney transplant status. Now coming to next category, that is Z95, which indicates presence of cardiac and vascular implants and grafts. The first code is Z95.0. It indicates presence of cardiac pacemaker or presence of cardiac resynchronization therapy, CRT-P pacemaker. The next is Z95.1. It indicates presence of aortocoronary bypass graft or presence of coronary artery bypass graft, CABG. That is indicated by Z95.1. The next is Z95.2. Presence of prosthetic heart valve or presence of heart valve NOS. The next is Z95.3. It indicates presence of xenogenic heart valve. The next is Z95.4. It indicates presence of other heart valve replacement. The next is Z95.5. It indicates presence of coronary angioplasty implant and graft. The next is Z95.810. Presence of automatic cardiac defibrillator or presence of automatic implantable cardiac defibrillator with synchronous cardiac pacemaker, or presence of cardiac resynchronization therapy defibrillator CRTD, or presence of cardioverted defibrillator. In all these cases, you need to code Z95.810. The next is Z95.811. It indicates presence of heart assist device. The next is Z95.812. It indicates presence of fully implanted artificial heart. The next is Z95.818. It indicates presence of other cardiac implants and grafts. The next is Z95.820. Peripheral vascular angioplasty status with implants and grafts. The next is Z95.828. It indicates presence of other vascular implants and grafts or presence of intravascular prosthesis. And finally, Z95.9. It indicates presence of cardiac and vascular implants and grafts unspecified. Now let us see an example. A 65-year-old male patient is suffering from hypertensive heart with systolic heart failure. The past surgical history indicates CABG, that is coronary artery bypass graft surgery. So first I11.0 to indicate hypertensive heart disease with heart failure, followed by heart failure code, that is I50.20 unspecified systolic heart failure. Then the status of CABG, that is Z95.1 presence of aortocoronary bypass graft. The next category is Z96, which deals with presence of other functional implants. The first code is Z96.0. It indicates the presence of urinogenital implants. The next is Z96.1. It indicates the presence of intraocular lens or presence of pseudophakia. The next is Z96.20. It indicates presence of otological and audiological implant unspecified. The next is Z96.21. It indicates cochlear implant status. The next is Z96.22. It indicates myringotomy tube status. The next is Z96.29. It indicates the presence of other otological and audiological implants or presence of bone conduction hearing device or presence of eustachian tube stent or staples placement. Z96.29, it indicates any of the following. And finally Z96.3, it indicates the presence of artificial larynx. The next code is Z96.41. It indicates the presence of insulin pump external or internal. The next is Z96.49. It indicates the presence of other endocrine implants. The next is Z96.5. It indicates the presence of tooth root and mandibular implants. The next is Z96.60. It indicates the presence of unspecified orthopedic joint implant. The next is Z96.611. It indicates the presence of right artificial shoulder joint. 612 indicates presence of left artificial shoulder joint. The next is 619. It indicates unspecified artificial shoulder joint. Presence of unspecified artificial shoulder joint. Next is Z96.621 indicates presence of right artificial elbow joint. 622 indicates presence of left artificial elbow joint. 629 indicates presence of unspecified artificial elbow joint. And 631, Z96.631 indicates right artificial wrist joint. 32 indicates left artificial wrist joint. 39 indicates unspecified artificial wrist joint. 41 indicates right artificial hip joint. 42 indicates left artificial hip joint. 43 indicates bilateral. This is important. Z96.643 indicates presence of artificial hip joint bilateral. There is bilateral code for hip joint, knee joint also. The next code is Z96.649. It indicates presence of unspecified artificial hip joint. The next is Z96.651. It indicates presence of right artificial knee joint. 652 indicates left artificial knee joint, and 653 indicates presence of artificial knee joint bilateral, and Z96.659 indicates presence of unspecified artificial knee joint. An important inference or point to remember is when it comes to artificial joints, there are only two bilateral codes. Bilateral code for artificial hip joint and bilateral code for artificial knee joint. And rest of all joints, they don't have the bilateral. Even finger joint. Finger joint also has a bilateral code. You can see here Z96.693 indicates finger joint replacement bilateral. Now coming to first code Z96.661, it indicates presence of right artificial ankle joint. 662 indicates left artificial ankle joint. 69 indicates unspecified artificial ankle joint. The next is Z96.691, finger joint replacement of right hand. Z96.692 indicates finger joint replacement of left hand, and Z96.693 indicates finger joint replacement bilateral. And next code is Z96.698. It indicates presence of other orthopedic joint implants. The next is Z96.7, indicates the presence of other bone and tendon implants, or presence of skull plate is also indicated by Z96.7. The next is Z96.81. It indicates the presence of artificial skin. The next code is Z96.82. It indicates presence of neurotransmitter, presence of brain neurotransmitter or gastric neurotransmitter, or peripheral nerve neurostimulator, or sacral nerve neurostimulator, or spinal cord neurostimulator, or vagus nerve neurostimulator. Whenever the physician documents any of these, Z96.82 is indicated. The next is Z96.89, presence of other super specified functional implants. And finally, Z96.9 indicates presence of functional implant unspecified. Now let us see an example. A 45-year-old female patient presents with left knee pain. Past surgical history indicates knee replacement surgery, right side. So first, the reason for visit is left knee pain. So the code is M25.562 to indicate left knee pain, followed by Z96.651, presence of right artificial knee joint. The next category is Z97 series that deals with presence of other devices. The first code is Z97.0, which indicates presence of artificial eye. The next is Z97.10, which indicates the presence of artificial limb, complete, partial, unspecified. The next is Z97.11. It deals with presence of artificial right arm, complete or partial. The next is Z97.12. It deals with presence of artificial left arm, complete or partial. Whether the physician documents complete or if he documents partial, in both the cases, this is the same code. The next is Z97.13. It indicates presence of artificial right leg, complete or partial. The next is Z97.14. It indicates the presence of artificial left leg, complete or partial. The next is Z97.15. It indicates the presence of left artificial arms, bilateral. And next is Z97.16. It indicates the presence of artificial legs, bilateral. Next is Z97.2. It indicates the presence of dental prosthetic device, complete or partial, or presence of dentures, complete or partial. The next code is Z93. It deals with presence of spectacles and contact lens. The next is Z97.4. It deals with the presence of external hearing aid. Next is Z97.5. It deals with the presence of intrauterine contraceptive device. And the next is Z97.8 is with the presence of other specified devices. Now let us see an example. A 33-year-old female presents with pelvic pain. She recently had a intrauterine device placement. So here the reason for visit is pelvic pain. That is R10.2. It indicates pelvic or perineal pain. And one more thing is we need to indicate the status of an intrauterine device because pain might have been caused by that device. For that, Z97.5 is indicated to indicate the presence of intrauterine contraceptive device. The next category is Z98. It deals with other post-procedural states. The first code is Z98.0. It indicates internal bypass and anastomosing status. The next is Z98.1. It deals with orthodesis status. The next is Z98.2. It deals with presence of cerebrospinal fluid drainage device or presence of CSF shunt, cerebrospinal fluid shunt. The next is Z98.3. It deals with post-therapeutic collapse of lung status. Next is Z98.41. It deals with catheter extraction status right eye. Z98.42 indicates catheter extraction status left eye. And Z98.49 indicates catheter extraction status unspecified eye. The next is Z98.51. It indicates tubal ligation status. The next is Z98.52. It indicates vasectomy status. The next is Z98.61. It indicates coronary angioplasty status. And Z98.62 indicates peripheral vascular angioplasty status. And Z98.810 indicates dental sealant status. And Z98.811 indicates dental restoration status or dental crown status or dental filling status. The next is Z98.818. It deals with other dental procedure status. The next is Z98.82. It deals with breast implant status. The next is Z98.83. It deals with filtering pleb after glaucoma surgery status. The next is Z98.84. It indicates bariatric surgery status or gastric banding status or gastric bypass status for obesity or obesity surgery status. Whenever the physician documents any of these, the code is Z98.84. The next code is Z98.85. It deals with transplanted organ removal status. That is transplanted organ previously removed due to complication, failure, rejection or infection. The next is Z98.86. It deals with personal history of breast implant removal. And Z98.870 indicates personal history of in utero procedure during pregnancy. The next is Z98.871. It indicates personal history of in utero procedure while a fetus. The next is Z98.890. Other specified post-procedural states or personal history of surgery not elsewhere classified. Finally, Z98.891. It indicates history of uterine scar from previous surgery. Now let us see an example. A 68-year-old male presents with morbid obesity. Underwent bariatric surgery 7 months ago and the current BMI is 37.4. So first the reason for visit is morbid obesity, that is E66.01, followed by BMI, that is Z68.37. Z68.37 indicates body mass index 37.0 to 37.9 adult. Here it is in the range 37.4. BMI is 37.4. It is in the range 37.0 to 37.9. And finally, Z98.84 to indicate bariatric surgery status. Now coming to the final Z99 category. Z99 deals with dependence on enabling machines and devices not elsewhere classified. The first code is Z99.0, indicates the dependence on aspirator. The next is Z99.11. It indicates the dependence on respirator or ventilator status. The next is Z99.12. It indicates encounter for respirator dependence during power failure. The next is Z99.2. It deals with dependence on renal dialysis or hemodialysis status or peritoneal dialysis status or presence of arteriovenous shunt for dialysis or simply renal dialysis status NOS. The next is Z99.3. It deals with dependence on wheelchair or wheelchair confinement status. The next is Z99.81. It deals with dependence on supplemental oxygen or dependence on long-term oxygen. The next is Z99.89. It indicates dependence on other enabling machines and devices or simply dependence on machine and device NOS. Now let us see examples. The first one is a 55-year-old patient presents with ESRD, end stage renal disease, and is on renal dialysis. So here the PDX would be N18.6 to indicate end stage renal disease, followed by Z99.2 to indicate the dependence on renal dialysis. Next example, a patient presents with right side hemiplegia and is wheelchair bound. So the first code is G81.91 to indicate hemiplegia unspecified affecting right dominant side, followed by Z99.3 to indicate the dependence on wheelchair. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.